Do you struggle to find answers to your pelvic health problems? Do you feel silenced in your quest to just feel better? Women, girls, sisters, if you have experienced infertility, PCOS, incontinence, painful periods, sexual trauma, and so much more associated with the pelvis, then Women's Pelvis Wellness is a place for you. Me and experts from around the world are joining here to get you the answers to the holistic health that you have been seeking. Please join us in being a pelvis wellness warrior. All right. Thank you so much for being here today. I have a very special guest, Lotus Family Chiropractic Wellness Way Osseo. That's her Zoom name.
Yeah.
But yeah, so Dr. Courtney Kloes.
Close.
Close.
Yep.
Okay.
Yep.
I was close.
Yep.
Like you've never heard that before, right?
Yeah. Yep. No, that's perfect. So thank you for having me. I'm very excited to be here. I was very looking forward to this. So thank you.
You're very welcome. So you are a chiropractor in central Wisconsin.
Yes. Yep.
And
go ahead.
Yeah, no, I'm just going to let you take it over. Just share your story and kind of, a brief synopsis of what got you to where we are now.
Sure. So my name is Dr. Courtney Kloes, like Amy just introduced. Me and my fiance, Dr. Shane Heiser, practice in Osseo, Wisconsin, about 20 minutes south of Eau Claire. We are both chiropractors and owners of Lotus Family Chiropractic, but then we're also the Wellness Way Osseo. So we have a very long name, so I like to explain that a little bit. First and foremost, we're a very family-friendly chiropractic clinic. We both have a love and passion for seeing entire families and helping families regain their health together. And I specifically love pregnancy, empowering women during their pregnancies, and then taking care of those children afterwards. So the Wellness Way part, we are affiliates of what is called the Wellness Way, a family of doctors. There's over 100 clinics now. One of our classmates opened in Ireland, so we're international now. The Wellness Way opened like 20 years ago, started in Green Bay, Wisconsin with Dr. Patrick Flynn. And he just opened his chiropractic clinic and had this great idea, which really is the foundation of chiropractic and our principles, that your daily thoughts, your daily traumas, and your daily toxins all add up and play into how your health, your health and how you live your life and to the best capability that you have. We do health differently, very differently. A lot of people get us confused with functional medicine or naturopath. We're similar, but not the same. Mm-hmm. Okay. Functional medicine and some naturopaths and other MDs who take more of a holistic approach, which is what we do. We take a holistic approach. They still have somewhat of the medical mindset. That's their training. They're just using a more natural form of either drug. There are more natural forms of drugs, or they're using supplements, but typically the same mindset of like, okay, you have this, this, and this, let's get you on omega-3s, all this stuff, and like, we're going to help you out. So our goal is a little bit different. We use very complete diagnostic testing. Like, you're not going to find anybody who tests you more than a Wellness Way doctor to find the full picture of your individual body and what's going on, your function. We use that picture and those diagnostic tests to find out any deficiencies, any areas of concern, and essentially support your body. We use supplements too. I'm not saying we don't, but it is never our goal to have you on anything like lifelong, because then we'd be no different than saying, here's a medication, take that for the rest of your life. We try to really restore. That's our big word, is we try to restore and rebuild. And that's the type of people we're looking for. So I see women who have been through the medical system, and myself included. I've been through the medical system for sure. It's those women that feel like they're really stuck and struggling. They've done all the things, they've gone all the places, and they still are struggling.
Mm-hmm.
That's when women come to see me.
Me too.
Yeah, exactly.
Yeah, me too. I did want to ask you a question. So like you said that you take like a really complete diagnostic. What are some of, like, do you actually do testing? Like, do you do spit tests or do you do any type of testing? What are the diagnostics that you typically do?
So essentially, any diagnostic test, blood, spit, urine, you name it, that even your medical doctor can do, we do as well. We use a variety of diagnostic companies to test. We do food allergies, that's a blood draw. We do hormone testing, which is a blood draw, and we actually use dried urine and not saliva. While saliva is the medical gold standard for hormones, in our opinion, it does not give us enough information. There's like 10 different estrogen metabolites that I don't even see on a saliva test that I need to know. We do autoimmune tests. Immune panels have been very big right now with the current COVID and trying to figure out your immune system. Stool tests. We have people poop in little French fry trays. You name it, we test it to figure out the full picture.
Sure. Yeah.
Mm-hmm.
No, it's really interesting because I know I'm 40 this year, so I have to go in and have all the things done. But it's interesting that you do that. Yeah, you brought up the food allergy thing because I have been struggling, and I may have mentioned it with you before because you know, we know each other. So, you know, Courtney and I have chatted before, but I have had flare-ups of rhabdomyolysis, myelitis. Yeah.
Mm-hmm.
And almost every single person that I've spoken to, functional medicine, integrative medicine, personal trainers, they all have said right from the get-go that it's a food allergy.
Yeah.
And in the medical field, I've had, oh my gosh, I've had so many blood draws. I think overall I've probably had 24 vials of blood, you know, over how many months.
Mm-hmm.
Muscle testing, all these things done, and they have no answers and they have no idea what it could be. And it was so interesting because I did look it up and it said that hypothyroidism could cause it. And I, you know, had a thyroid panel and everything done. And they said that it could, my doctor told me that it would not be related. And I said, well, it says on Google that it can. And she's like, well, you know, I mean, and I understand like not everything on Google is accurate. I totally get that. But I thought, well, I should bring it up because this is what I found. And so, yeah, still no answers. The next thing that they want to do is a muscle biopsy. And I'm like, that's pretty invasive. So I think I'm going to say no, but I've gotten it a couple more times. They're very mild, but I know that that's what it is. And I have to find out what this is. So I need to get some allergy testing done.
Yeah.
That's the one thing when I call to, I'm going to do a mammogram and I'm going to do a thermography session. I'm going to do both because actually I'm going to make it an educational thing with my clients.
I love that.
You know, because I want to do the comparison because, you know, there's controversy about that. And, but yeah, anyway, going way off topic, but the allergy testing is going to be huge because, I mean, the basis of all physical nutrition or physical issues is nutrition, you know, apart from the whole, you know, energy, mindset, emotional stuff.
Yeah. Here's another way to look at it too, is that food allergies, especially when we test them, the Wellness Way test them, we use a lab called immunolabs. So anybody could go out and get this. This isn't something you can get just from us. It's called immunolabs. They're in Florida. When you get that test, it's really a picture of your immune system. It's not necessarily nutrition. So with rhabdomyolysis and things like that, any immune system reaction that is causing it, so whether that's hypo or hyperthyroid, whether your body is eating away muscle tissue, any type of immune system reaction, getting your food allergies tested really shows you what's your immune system also concerned about with food.
Right.
And when you take that added stress of eating foods that your immune system's worried about, your thyroid, your immune system's worried about all these things, and when people remove their food allergies and see what their immune system is trying to fight against with that, the healing, like the sky's the limit with healing, because
Right.
your immune system, you just take a huge load off of its shoulders, and you're not causing daily reactions, almost like stubbing your toe. Like you stub
Right.
your toe in the middle of the night and you're like, son of a, that really hurts, but it goes away after a while. Food allergies, it's like you're stubbing your toe every
Every day.
single day.
Yeah.
And then you get inflamed and it's throbbing and it hurts. And that's part of your immune system is what's doing that. It's flagging foreign food.
Yeah.
So yeah.
Intuitively, I feel it's dairy, and I'm really bummed about that. Because, I was raised on a farm, and I totally feel like I'm betraying my people. I honestly do. But the only dairy I have now is like cheese curds and butter. I don't have, I don't have it daily and things like that, but I definitely know when I have it. The cheese curds are so good.
I know. I wish it wasn't true. I'm always got to figure it myself. And I know across from people, and I'm like, you're allergic to dairy, you're allergic to casein, you're allergic to goat's milk sometimes. Like, thankfully, there are many, many alternatives now, even like since 5 years ago. It's wild how many alternatives there are that really help people transition. But
I think that's part of the difficulty too, because people don't know, like me, I don't know which almond brand, which almond milk brand is the best brand to do. And then there's also controversy about almond milk and the bees and, like all that stuff. So then do you do coconut milk, and then do you do this, and then do you do that? And it's like, we should just drink water.
I know
water.
The companies, our food industry has really let us down, to be honest. It's all about the marketing. It's all about the colors. It's not about the quality. It's about the quantity. So on top of making a huge lifestyle change, to go dairy free or gluten free or whatever it is, you have to go and like read through those ingredients. And it's insane, the additives that they'll put in there to try to make it taste good. I mean, if you go gluten-free, and if you actually go for gluten-free products, I caution people all the time, because you can send yourself into pre-diabetes if you just consume the same foods but gluten-free, because they're used with rice and all these high sugar flours that people don't necessarily think like, this is sugar. Like, rice is healthy, but it's still sugar. So I've seen a lot of people just go down that route. Meat and veggies. It's much cheaper, one, and it's easier. You don't have to read ingredients labels.
Yeah. Yeah. So anyway, thank you for that little side note. So proceed.
Yeah. So the premise of like the wellness way, and speaking of like your autoimmune or whatever might be going on immune system, the wellness way, and even chiropractic for the most part, our philosophy is that the body never makes a mistake. It doesn't. I don't know if you would agree with that.
Well, I definitely think it's clearly telling you a story. I mean, you might not like what your body is telling you, so you may view it as a mistake, but it's telling you a story, and you need to pay attention.
Exactly.
I mean, I tell this to women all the time.
Exactly.
They have to know their norms. So.
Yep. So the perfect example is when you go out. So it's going to be winter here pretty soon. So we're going to strip you down, Amy. We're going to throw you out in the snow, and we're going to see what happens. What's your body going to do to protect you? You're going to start shivering, right? You're going to start shivering to pull all that blood flow to your inner organs. Your fingers, your nose, your toes, they're all going to get really cold because you don't have that out there, because it doesn't care about your fingers and toes.
Right.
You might get frostbite. You might even lose a finger or lose a toe. But let me ask you, is that what your body should have done?
Yeah.
Yeah, it should have, because we can live without a toe. We can live without a finger. You can't live with anything else. So you can apply that to any condition.
Sure.
You can take the steps back and figure out this is what your body was doing. It's always trying to do the best it can and keep you alive. It's as simple as that. Right. And that's where it's my job to like dig through the history, figure out your triggers and when it really, really went wrong, which is what eventually we're going to talk about more specifically with women's health. Like when things could have gone wrong for you and trying to figure that out.
Right.
Mm-hmm.
Yeah, no, great.
So anything else, any questions for me?
Well, you never really told us about how you actually got interested in chiropractic and like what happened.
True. So
a little bit more about you personally, you know?
Yeah. So how did this start? I was going to be a physical therapist. I went to Winona State University in Minnesota, and I got a job at a chiropractic office my first summer after college. And to be completely honest, I hated it. I was like, there is no way I'm doing this. It was like an assembly line type, very insurance-based, quick out, like, I was like, this, and I had never been adjusted before. I was like, this is what chiropractic is? Like, no wonder I've never been.
Right.
So, and she was like, I'm going to make you a chiropractor, like, you know, not a PT. And I was like, no, I think I'm going to do my own thing. Like, you're not going to tell me what to do. I was fresh in undergrad and just feisty a little bit. So fast forward to finding another mentor who I found through the softball program at Winona State, which is another story, but she was a chiropractor, Dr. Kristen in Winona at Infinity Wellness. She was an entirely different chiropractor than the previous one I had worked for. She was spending 20 minutes to 30 minutes with every single patient. She knew everybody's family members, everybody's everything, and incorporated all that information to help the individual in front of her, whether it be with mental health. Of course, she was adjusting, and then she also was doing NRT, so muscle testing, which myself, I'm actually certified in. I've been certified a couple times, that's where my journey started. As I started seeing her, I was having terrible periods. I was having migraines like 3 times a week. I couldn't go to class. I couldn't go to softball practice. I was planning my entire life around my cycle. I know some women can totally relate to that, where you're like, this is when it's happening. I can't do anything for like almost this week and a half, because you never know when it's going to come.
Right.
And she muscle tested me, and like my liver. I just remember that. And it was making sense. I understood, and I took the classes, and I even became certified myself. But then it was like, I mean, you're on so many supplements, and it never took the question like the step further. Like, but why is my liver sluggish? Or like, where in my liver is like this issue happening? It's just that like this overall organ is malfunctioning, you know? So after that, fast forward to being in chiropractic school at Palmer in Davenport, Iowa, the Fountainhead, which is where she had gone. And I met my fiance, Dr. Shane, while we were in school. It's a very rigorous program. So we were best friends up until about halfway through. And eventually we kind of were like, we really like each other. We love the same things. Like, I was the one who initiated, like, we should probably like see where this goes. And he was like, yeah, I think so too. And everybody in the school had already called it. But we we were only doing that muscle testing up to that point. Like that was our adjusting, and we had both been certified in NRT. Then we meet this Dr. Patrick, the Wellness Way founder. He came to school and did this hormone test, this hormone connection webinar, or not webinar, in person. And we were just blown away by, we had learned everything in school. We take 4 rounds of boards, we take PT, we take all these things, but nobody had ever put everything like into perspective and used it the way that he did, with the foundation that the body is not making a mistake.
Right.
And even in school, they were like, autoimmune, like your body is attacking itself. It's not. Your body is going after a virus or something that's not supposed to be there. And unfortunately, it's taking part of your tissue, but it's actually doing that to save your life.
Right.
So we were blown away by him and his awesome idea. And at that point, he only had a handful of clinics. And then fast forward through school, we were seeing patients who had been adjusted their entire life. I mean, Palmer in Davenport, Iowa is like the fountainhead. Everybody goes there. It's one of the biggest chiropractic clinics in the world. They have some of the best doctors. That's where we do our like residency, you would call it. And these people have been adjusted their entire life, but they were still struggling from health conditions. And it was like, now what? Like, we can only help these people so much.
Right. There's got to be more.
There's got to be more. So after meeting Dr. Patrick, we decided to be the first students to ever open up a Wellness Way clinic. So that was a super big move for us to open up right out of school as students, let alone take on this huge holistic healthcare system that we're literally fighting an uphill battle, which you feel every day too. Mm-hmm. Going against that grain that people have been conditioned their entire life to do one thing, and then you step in and you're like, have you ever thought of this?
Right.
And it's hard. It's hard sometimes. And
what's even more frustrating I found is when somebody comes in with a condition that I've never heard of, and I don't know how to help them. Mm-hmm. And I don't know anybody offhand who can help them. So then I'm like searching frantically, to all mm-hmm. my connections. Like, have you heard of this? Have you heard of that? And thankfully, like, somebody always knows somebody, but mm-hmm. it's that first initial, like, oh my gosh, I have no idea. I am completely stumped, mm-hmm. Because there's a lot that I don't know.
Yeah.
So that's why there's referral networks.
Yeah, absolutely. Absolutely. And speaking of like specific conditions, like I was suffering from the migraines. I was like chronically constipated, those painful periods, brain fog, started getting really bad anxiety with all the added stress of graduate school. But the Wellness Way we don't treat any specific disease or illness. Like right. I see people all the time with endometriosis, PCOS, hellish menopause symptoms, cancer, you name it. I see people struggling, but it's not my goal to like treat your endo. It's my goal to test your body. I know normal physiology. So when I test you and I'm looking at your labs, I want to rebuild you back to normal. Right. I want to rebuild your body. And with that comes so many benefits. People lose weight, their brain fog goes away. Like they come in for help with one thing, but when you start to rebuild the body, so many things get better. Right. And mm-hmm. it may or may not be in the order that you wish.
Right.
Because it's all about your body's priority. But
I'm going to send my parents to your clinic. I am. They live in Stanley. I mean, they're close.
We would love to see them. So fast forward through my Wellness Way journey, I had all those things going on. I had started care with Dr. Alex Fennelly, she practices out in Montana. Got my food allergies tested and my stool tested for migraines. And most people would be like, what? Why?
Where's the connection?
Yeah. And
that's where it starts. It starts in the gut.
Exactly. It's the biggest foundation of health. Like you can't, it's like if you're gonna grow a garden and you go out there and you just like, I'm gonna grow this garden, I'm gonna throw all these seeds out. But you don't do anything to like till or pull the weeds and prep your garden. It's like that's what we were doing before. We were just trying all these things. But once I actually got my food allergies and my stool test, I could make my body the foundation healthy. And then
Right.
my migraines are literally gone. And I had them like 3 to 4 times a week. And it
Yeah.
was all food allergies. Like now we get our food allergies tested once a year. And I can trace it back. Like if I have a migraine or if I have like a headache or something comes up, I can always trace it back to I ate out at this place that they probably had something in the seasoning or something there, or I was at this friend's house and they didn't really know that we were allergic to whatever. But
Right.
it's so clear now. It's not just like this blur of a life, just painful life anymore. It's crazy. It's awesome.
Yeah. Well, I mean, if you don't feel good, you're not going to enjoy any part of life,
No.
you know, and everyone around you, especially, you know, like me being a single mom of 3 kids. I mean, if I'm feeling sluggish, that obviously affects them. You know, I mean, I still have to get out there and do things. You know, I mean, my mom, I remember her being run down all the time, working way too much, probably not, you know, taking care of herself. And, you know, she was always too tired to do anything. You know, Dad was basically too tired to do anything either, you know, and I don't want to be that for my kids.
No, and I don't either. That's where a lot of us have to really look inside and look outside. Is this the future that I want? Am I
Right.
using and doing the same habits of my parents or whoever, you know, you're looking up to? Am I doing those same things and am I going to end up there? Or should I change something so I don't end up where I don't want to be, you know?
Right.
But, if it's okay with you, I would love to share one more analogy about like our view on the healthcare system and like
Absolutely.
why you would come to see me.
Sure.
So we have this awesome analogy for the healthcare system versus wellness way, holistic care. And we call it the fireman and the carpenter principle. Okay. So if you were to think of your body like a house, we're going to say that your body's like a house.
Mm-hmm.
If your house were to burn down, we all know who you're going to call. You know who you're going to call. You're going to call 911. You're going to call the fire department, and they're going to come put the fire out at your house.
Right.
We also know that you would never call your dentist. You would never call a lawyer or anybody who has like no idea how to put out a fire. Like the firefighters know what to do. That is their job. They have an amazing job and a very important job. They show up at your house that's on fire, and they show up with their tools, which are axes and hoses. So when the firefighter shows up at your house and they take that axe and they break down your door, they might break out a window, they might break down a wall, they're going to spray down your entire house, they're going to spray down the walls, they're going to spray down your furniture. So is that water, is that axe and all the things that they did, is that good for your house?
Yeah, because they're trying to save the house.
Overall, they're trying to save the structure of the house, but is it good for your walls and for your carpet?
Well, of course not. No, and I see what,
Yeah, for the pictures of your kids on the walls, like it's not good for that stuff. You have collateral or different damage being brought in, but then to save the overall structure, which is what we want. So they do that. They put out your fire, and we're all happy, myself included. We're standing there like, thank God nobody got hurt. The house is still standing. Like we're all patting each other, you know, patting the firemen on the back. Like we're so happy. But in reality, they still like
the house.
Like you're still like, well, crap, I can't go back into this burned up house. Like technically they can legally keep you out of a house because it's unsafe. So then who do you have to call to go back and live into your house? The carpenter. So that's where that guy comes in. Okay. So we're going to call the medical community the firefighters, the 911, they're putting the fires out. And we're going to call wellness way doctors the carpenters. So you call that carpenter and he walks into your burned up house and he comes in there with a completely different perspective.
Right.
Now, if that carpenter showed up to try to put your fire out and he shows up with all his tools and he's like, I brought my hammer and my nails and I brought some plaster and the fire's still blazing, the firemen are going to be like, you freaking idiot. Like, what are you doing? We don't get out of here. Right.
Right.
And vice versa. If the carpenter is thinking that the fire department's going to show up with their axes and hoses and try to rebuild your house with only that, the carpenter is going to be like, you guys, this is not your job. You know, your job is done.
Right.
And if there's no offense to either one, it's just the perspective that you have. So that carpenter is making a list of all the new supplies he's got to bring, all the different tools, all that stuff to rebuild your house to get you back in there. So again, medical community, fire department, carpenters, wellness way doctors.
Sure.
So let's apply this to like a real life scenario. Let's say you and I are actually sitting next to each other for this interview in this podcast, and you all of a sudden go into a massive heart attack. Knowing my credentials, being I have a movement science degree, a nutrition minor, I'm a chiropractor and a wellness way doctor. Amy, are you comfortable with me going into the kitchen, grabbing a knife and trying to save you?
No.
No, you can call me an idiot. That's that's not what I'm here for. I'm the carpenter. I'm the rebuilding doctor. So we would call 911. Right? We're going to be like, okay, call 911. They're going to get you to the hospital as fast as possible. And they're going to use their tools, their axes and their hoses. They're going to stick you with their hose, put the medication in you to try to help. And if that doesn't work, they're going to take their little axe and they're going to cut you open. Okay? And that is going to save your life, hopefully. That's what our doctors are really, really good at, is saving your life. And the flip side, just like was the water good for your walls, is that medication good for your body? It
not long term.
It saved your life, thank goodness, but is it truly good for your body? There's going to be collateral damage, just like when you spray down the walls of your house to put the fire out.
Sure.
So you have to then call a carpenter unless you want your house to be sprayed down every single day with water, which is what I like medication. You're just spraying your house down every day, hoping that fire doesn't start. But what the carpenter does is figure out where that fire started in the first place and getting your house back rebuilt so no fire ever starts again. So if someone's in a heart attack or fire department situation, of course, drugs and surgery may be needed. We can all agree on that. We have some of the best doctors, research, the best hospitals, but it's really for that like 911 fire situation.
Sure.
Yeah. And that's where we come in, is if you don't want to water down your house every day, some people do and knowingly like take the medication. It's just what they want. That's fine with us. But people who we see are the ones who that was their only option, is that medication every single day, or there were no answers on why their house started on fire, their body even got to the point that it was. And then we're the carpenters that come in. We test everything, we rebuild everything, and we get you back to like your best version of yourself.
Yeah.
Mm-hmm. So that's my analogy for what we do.
That's really good. That's really good. Yeah, I know that it is really interesting, because that's what brought me to, meditation and Reiki, is because I didn't want to go on medication for, depression and anxiety. I mean, as a nurse, like I said, I know it's needed sometimes, but for some reason, I just had it in my head that if I went on it, I would never come off it. And I didn't want to be on it for life.
Yeah.
And I don't know why I had that picture in my head, but you
Mm-hmm.
know, I just didn't want to do it. So
Yeah.
thankfully I had a therapist who suggested, energy healing and meditation.
Yeah.
So,
And I
and
am
that's been,
all the whole, like myself and any other wellness way doctor, we're open to all other, the technique that you do, Reiki, like whatever it is, as long as your body isn't being like flat out manipulated
right.
by a drug that like you can't control, like there is no one size fits all. So
Mm-hmm.
that's why somebody could try acupuncture and it just changes their entire life. Or
Yeah.
someone comes to you and like that was the answer. They felt the connection with you, like that's what their body needed. Like I'm all for that.
Mm-hmm.
Just don't go manipulating your body to the point where like you're sitting in front of me, you're on 18 medications because every medication has a side effect.
Right.
Now we have to rebuild your body that's literally just like so moldy
Base
and
level, right.
yeah, it just
I I've heard this before. I've had a couple clients tell me too that, they've been on birth control. These are women who are in their, mid 40s to sometimes early 50s. And they're
mhm.
still on the same birth control that they were at, like 20. Like they've been on it since they were 20.
Yeah.
And I was actually told that someone's OB suggested they just stay on this till they're about 55, because then they can just come off of it and they'll already be through menopause.
Menopause. Mhm.
And I'm like, that's not how it works. And I'm
Mhm.
like, I can't believe that. Well, I guess I can. That a medical doctor would say, that any doctor would say, I think it's a good idea for you to stay on this birth control for 25, 30 years and then just come off of it.
Yeah.
Then you'll be through menopause and everything will be fine. Like,
I mean, you got to remember that's their tools. That's their
right.
only
Those are their
training is
tools.
drugs and surgery. They don't
Yeah.
have anything else to offer. So they're always going to offer something long term like that because that's not what they're trained in. That's what we're trained in, is to do the
Right.
other things to get you back to health. And so you're not relying on the system that just feeds you pills every day.
Yeah. I just can't believe, I think about their bodies, like I said, being manipulated for decades and then coming off of it. And
Mm-hmm.
it's not going to know what to do. It's going to,
Oh no, there's a huge learning curve
you know what
for
I
the
keep,
body.
the picture that keeps popping in my mind. It's like Jurassic Park. Like we have all these dinosaurs that have woken up billions of years later.
Yeah, yeah,
It's going to be awful.
yeah, yeah. And
Yeah.
it's the truth. It happened with me. I was on birth control, tried them all for almost 10 years, and
Yeah.
I'm still feeling the side effects. And I even know that my hormones, I've tested them. My hormones are perfect, but I still don't feel that great during my cycle because my uterus is still trying to shed layers and layers from not having a period for 7 years straight.
Yeah. I
That's not
know.
supposed to happen.
I know.
Mm-hmm.
It just, it blows my mind. Like, this is the natural thing. If you can't see that, if you alter the natural cycle for decades and then expect everything to be okay,
Yeah.
once you stop, falsely altering it, I don't know. Yeah.
Mm-hmm. Mm-hmm.
But
So
yeah,
yeah.
so you had mentioned something when we were talking earlier, and I think that we're probably getting close to talking about that point, is when, because you said, when you're looking at like your life and the
Mhm.
building blocks of your health, we have to actually look to when we were in utero.
Right. Right. So if you think of, well, let's just paint this picture of like what we're led to believe. Like you were led to believe that you're a baby, your mom had you, you go through this perfect childhood life. When you decide you're going to have children, you're going to get married, have children, it's easy. You have your baby, you come home, like all is fine. That is not reality today. We have more infertility, we have more treatments, IVF, UV, like you name it. There are so many treatments, which that
We also
shows.
have more birth issues, like more birth defects, more miscarriage.
Mm-hmm.
Yeah.
Yeah. So now you're having, you have this baby. It's very medicalized now. Whether you conceived medically or you had the baby in the hospital, there's other interventions. Then you go into puberty. Okay, you're a female in puberty and they say, we'll put you on birth control because you have terrible acne or you have painful cycles or whatever it may be. This is our option. Okay, here's your birth control. Then these women get to adulthood who have been on birth control, like you said, for life sometimes, 10, 15 years, and they want to have babies. Well, now 1 in 6, and I think honestly, it's like 1 in 4 women now are struggling with infertility. And we wonder why, when they've been on a hormone, an exogenous hormone that's been manipulating their body this entire time. Fast forward to menopause, and we have like hellish symptoms, meaning that if you have hot flashes, vaginal dryness, your hair thins out, or you start losing your hair, like all of those things, if that happened to you or is happening to you, that means that when you entered menopause, your hormones were not right.
Right.
You can go into menopause and should go through menopause without any negative symptoms that we're all just like told, like, we hate menopause. It's the worst thing ever. The hot flashes, like, it's awful. So you have to start at the beginning, which is when your grandma conceived your mom. That's really when it started, because you are actually as old as your grandma.
Right.
When your mom was in your grandmother's belly, you were an egg in your mom, and your mom was a baby.
Right.
So for us, not so much, it's going to be completely different for the kids today, but for me and you, when our moms were pregnant with us, there were some hardcore medications given to help with reducing miscarriages and different things like that, which ultimately we found led to birth defects.
Mm-hmm.
And now one of the main drugs that was used to decrease miscarriages for women our mom's age and even our grandma, it's now used as a Plan B pill. Look it up.
Crazy. Well, if it's a Plan B, how can it reduce miscarriage?
Yeah. So now all these women who took it while they were pregnant, it's found to be much worse if you were a female in utero. Now they're all suffering from infertility because, yes, it was supposed to help abort that baby like the Plan B is supposed to, but they were taking it on a daily trying to help reduce miscarriages.
Well, then how could those babies even survive?
Because mom's too far along. Because at this point, they're complaining of morning sickness and like negative.
Oh, right. Because Plan B is like right after. Gotcha.
Right. So now it's right after. But back in the day, you would go and say, like, I am having a really rough time with this pregnancy, or I've had miscarriages in the past. And they're going to say, like, okay, well, then we're going to give you this. And now they use it for an entirely opposite reason.
Wow. Mm-hmm. I never knew that.
So that's where you have to start. You have to start at the beginning of truly your life. So uterine environment, which you know is extremely important, important.
Right.
And regardless of medications, I mean, back in the day, women were smoking, drinking, doing all those things like that. All impacts the uterine lining, impacts the environment and how you grow and develop in your mother. Mm-hmm. So
yeah, my mom said that she said she was never really a heavy smoker, but she did smoke with her first 2 pregnancies, which were my older brother and me. And then she stopped with the other 2. But it was funny because she told me, she said, I absolutely love smoking. And if it wasn't bad for me, I would still do it now. Yeah. There are a lot of people who have quit, but who have said that same thing to me. That they just love like the taste of it, the socialization and whatever. Yeah, very interesting.
Yeah. So maybe to conclude that would be, we've heard of epigenetics a lot, which is where like that would start, right? Like when whatever your grandma was doing and your mom was doing while Well, you
Oh,
would
grandma smoked like a chimney, man.
So
I mean,
now,
she did.
for those who don't know what epigenetics is, it's a study of how, your grandma, your ancestors really played into your life and your genetics now. But
Sure.
no geneticist will argue that while sometimes genes can be turned on that are in negative fashion, those genes can still be turned off. So when I sit in front of someone who, and I hear this every day, my doctor says it's genetic.
Yep.
I personally think that's the biggest cop-out ever.
Yeah.
I think it's a very easy answer to tell somebody and and put the problem all on them. I put the problem all on them in a different scenario, a different way, being that I ask you to look at, are you following the same habits as your mother? And was your mother taught the same habits as your grandmother?
Right.
So if they had issues doing the lifestyle that they were having and leading, and you're choosing to follow the same lifestyle, wouldn't you agree that it's more likely that that gene, that it's going to turn on for you if it turned on for them? Absolutely.
Right.
But I see people every day who flip, and this is really hard too, when you have to tell your mom and your grandma that no, moderation is not okay, and no, I can't have the cookies and I can't have the things that I'm allergic to now. It's hard for family members to understand if they don't understand what you're going through. So it can be hard. It can be difficult to really transition when you've learned things from mom and grandma and they're like traditions. But it's that question on, is that what you want your life to look like when you're their age? And maybe it is. Maybe they did great.
Yeah.
They're healthy. And I really hope so. My grandma is extremely healthy, 81 years old, and has a hobby farm, cows, goats. Like, she's so active and I'm so proud of her. But that's really not the typical scenario today.
Yeah, none of my grandparents made it that far. Yeah. Lots of smoking, filterless Camels. Lots of drinking. And, I mean, they, I think that they ate a ton of, well, they probably ate actually fairly well for, as hard a work as they did.
Yeah.
Absolutely. So, but yeah, I mean, they had to cook from scratch. They didn't have the processed stuff, so that is obviously going to be much healthier than anything we have now. I mean, even going to the farmer's market makes me feel so good, but I know that stuff isn't organic. Yeah. I mean, it's beautiful and it's great and it's cheap and it makes me feel good, but I'm like, I know that this isn't organic.
I know. It's tough. It's becoming very tough.
Yeah. So I think we should definitely schedule another interview and have you on again, because I feel like we just barely scratched the surface.
Agreed.
But this is definitely something that is really, really important. And I will definitely be chatting with you about some stuff after we stop recording. But just let everybody know really quick how to find you. And if you have any kind of like an offer or any event coming up that you might want to share.
Sure. So you can find us, Dr. Shane and I are very, we're all over Facebook. That's where we do a lot of videos, educational things, but our website is thewellnessway.com. That will bring you to the main page. And with having over 100 clinics across the United States, you can search your area code and where to find a doctor near you. That being said, I have patients virtually all over Washington, Montana, Nebraska, Michigan. So we see people, all over the US virtually with the Wellness Way. I can't adjust you over the phone, but I can give you Wellness Way recommendations and testing. But really on Facebook, it's Lotus Family Chiropractic, the Wellness Way Osseo. And our little hashtag is Lotus Family Chiropractic, TWWO. And I guess our big event coming up, and I don't know when this is going to be released, but we have our 1-year celebration on October 4th at Together Farms.
Okay.
So I would love, Amy, I would love for you to come and your family to come. It's open to the public. It's like a community appreciation party. We're going to have pumpkin decorating and cupcakes, and the food truck's going to be there, and it's going to be an afternoon of fun. Yeah, it's on Sunday, October 4th from 11 to 3 p.m. So
cool. Awesome.
That's our next thing. Yeah.
Great. Well, thank you so much for being here with us today, Dr. Courtney. I really appreciate your time.
Yeah, I appreciate you too. Thank you so much for having me, and thank you for doing this, being a leader in women's health and pelvic wellness. It's awesome.
Thank you so much. I appreciate that.
Yeah.
Thank you for joining me today on Women's Pelvis Wellness, where you can be heard. Because remember, if you're not being heard, you're not being helped. Please join my Facebook group by the same name, Women's Pelvis Wellness, and join a community of women who are there for you to support you, guide you, and love you through your pelvic health struggles. Also, this is a great place to check out my new class schedule. Thank you for joining me and becoming a pelvis wellness warrior.